Have you ever noticed two people eating the exact same amount of rice, same quantity, same time, but one person's blood sugar spikes dangerously high while the other stays completely stable? This difference is not about the rice, it is about what they ate alongside it. This is how powerful food combinations are. The right ones can actually protect your pancreas, slow down glucose absorption, and prevent the damage that builds silently for years. The wrong ones can push you toward diabetes, damaged blood vessels, and failing organs, even when your diet looks perfectly normal on paper. And here is the part that concerns us most. Most people are eating the wrong foods without even knowing it. Over 100 million people have diabetes today, and millions more are in the pre-diabetic stage, completely unaware. But nature has quietly placed some incredibly powerful ingredients in our own kitchens that can actually help reverse this. Today, we are going to talk about 4 of those ingredients. Powerful kitchen staples that slow down glucose absorption, repair your insulin response, and protect your pancreas from years of damage. And we are going to show you exactly how to consume them to get the best results. If you are new here, welcome to Health is Golden, where we cover the health information that actually matters, explained clearly and without the jargon. Hit subscribe and turn on the notification bell right now so you never miss a video. And if you find this helpful, give it a like so more people can benefit. Now let us get started. How food actually raises your blood sugar. Before we talk about these ingredients, let us first explain what blood sugar really means, because once you understand this, everything else becomes very clear. Whenever you eat food that contains carbohydrates, rice, bread, fruits, certain snacks, your body breaks it down into glucose, a simple sugar that enters your bloodstream and gives you energy. Normally, your pancreas releases a hormone called insulin, which acts like a key that helps glucose move into your cells where it is used as fuel. The problem begins when the food you eat releases glucose too quickly, or when your body stops responding properly to insulin. In that situation, sugar stays in your bloodstream longer than it should, causing spikes after meals and gradually leading to insulin resistance and diabetes. Over time, these repeated spikes damage blood vessels, nerves, and organs. This is exactly where the right foods can make a powerful difference. Some foods slow down how fast glucose enters your blood, some improve insulin action, and some actually protect the organs that control blood sugar balance. Now let us talk about 4 of those foods, and they are sitting in your kitchen right now. Before we get into the list, drop a comment below and tell us, are you managing diabetes in the pre-diabetic stage or just trying to protect your health? Every comment get read, and we genuinely want to know who we are helping today. Number 4, fenugreek seeds. If there is one ingredient sitting quietly in almost every kitchen that has a direct and powerful effect on blood sugar, it is fenugreek seeds. You may have seen people soaking them overnight or adding them to food. But the reason it works goes much deeper than tradition. Fenugreek contains 2 very special compounds that make it uniquely useful for people managing diabetes. The first is a type of soluble fiber called galactomannan. The second is a rare amino acid known as 4-hydroxyisoleucine. When you eat fenugreek, the soluble fiber absorbs water and forms a thick gel-like layer inside your digestive tract. This gel slows down how quickly carbohydrates break into glucose. Instead of sugar entering your blood all at once, the release becomes gradual and controlled. Think of it like placing a speed breaker in front of glucose absorption. Because the glucose enters slowly, your pancreas does not have to release a sudden burst of insulin, and this prevents those sharp spikes that damage blood vessels over time. The second compound, 4-hydroxyisoleucine, works in a completely different way. It directly supports the pancreas by improving insulin response when blood sugar rises. This means your body uses insulin more efficiently instead of overproducing it over time, which reduces insulin resistance. One of the main reasons blood sugar remains high in many people even when they try to eat healthy. Fenugreek also slows down the movement of food from the stomach to the intestine. Many people notice that after adding fenugreek regularly, they feel less sudden hunger and fewer energy crashes during the day. This happens because stable glucose levels prevent those rapid highs and lows that make you crave sugar again. The right way to consume it. Soak 1 teaspoon of fenugreek seeds in water overnight and consume them in the morning along with the soaked water. Soaking softens the seeds and activates their soluble fiber, making them easier to digest. If chewing seeds feels difficult, lightly crush them or add a small pinch of powdered fenugreek to warm dal or vegetables during lunch. The key is consistency rather than large amounts. Excessive fenugreek can irritate your stomach. Did you know fenugreek seeds contain a compound that directly improves insulin response? Type fenugreek, in the comments if you're going to try this. Every comment get read. Number 3, jamun seed powder. We all know jamun as a seasonal fruit, but the real power for blood sugar control lies inside its seed. Jamun seed powder has been used for generations, not simply because it lowers blood sugar, but because it changes how your body handles carbohydrates from the very beginning of digestion. When you eat foods like rice or bread, your digestive system uses specific enzymes to break starch into glucose quickly. Jamun seeds contain natural plant compounds that gently slow down the activity of these enzymes. Because of this, carbohydrates take longer to convert into glucose. Instead of a sudden surge of sugar entering the bloodstream, the rise becomes more gradual, and this is especially useful for people who struggle with post-meal sugar spikes even when they're careful about their diet. Another reason jamun seed works differently from fenugreek is its effect on pancreatic function. Certain bioactive compounds in the seed help protect the beta cells of the pancreas, the cells responsible for releasing insulin. Over time, high blood sugar creates oxidative stress that weakens these cells. Jamun seed powder contains natural antioxidants that reduce this stress, allowing the pancreas to respond more steadily instead of becoming exhausted. It also influences how glucose is used at the tissue level. Research suggests that jamun seed compounds improve the way muscles absorb glucose, meaning more sugar is taken up by the cells for energy instead of staying in the bloodstream. This makes it particularly helpful for people who feel fatigue and heaviness after meals, because stable glucose usage prevents those sudden energy crashes. The right way to consume it. Half a teaspoon to 1 teaspoon of finely powdered jamun seed taken with lukewarm water once a day, preferably after lunch. Taking it after a meal allows it to work directly on the digestion of carbohydrates rather than irritating an empty stomach. Consistency matters more than large amounts, as excessive intake may lead to digestive discomfort. We are halfway through this list, and if this is giving you genuinely useful information, hit the like button right now. It costs you nothing, and it genuinely helps this reach more people who need it. And share this video with someone in your life who is managing blood sugar and some outbreak. You might be giving them something that makes a real difference. Number 2, cinnamon. Let us explain why cinnamon is not just a spice, but a very specific metabolic support for blood sugar control. When you consume cinnamon regularly in small amounts, certain active compounds directly influence how insulin works inside your body. The most important of these are cinnamaldehyde, cinnamic acid, and a group of polyphenols called proanthocyanidin type A polymers. When you eat carbohydrates, glucose enters the bloodstream and insulin has to bind to receptors present in your cells. In people with insulin resistance, these receptors stop responding efficiently, which means glucose stays in the blood longer. The polyphenols in cinnamon improve the activity of something called insulin receptor kinase, an enzyme that helps the insulin receptors become more active. At the same time, cinnamon reduces the activity of a protein that normally weakens insulin signaling. By strengthening receptor activation and reducing the signals that block insulin action, cinnamon allows cells to absorb glucose more effectively. Cinnamaldehyde, the compound responsible for cinnamon's aroma, also influences glucose metabolism through a different pathway. It activates AMPK inside muscle and liver cells. AMPK is often called the body's metabolic switch because it increases glucose uptake and improves energy usage. When AMPK is activated, your muscles pull more glucose out of the blood, reducing post-meal sugar spikes without forcing insulin to work harder. Another important action happens in the liver. The liver produces glucose through a process called gluconeogenesis, especially between meals or overnight. Cinnamon compounds help reduce the activity of the enzymes involved in this glucose production. By slowing these enzymes, cinnamon actually prevents excess sugar release into the bloodstream, which is why many people notice better fasting sugar levels when cinnamon is used consistently. Cinnamon also slows the activity of digestive enzymes responsible for breaking down complex carbohydrates into glucose. Because these enzymes work more slowly, glucose enters the bloodstream at a steadier pace instead of causing sudden spikes. The right way to consume it. About 1/4 teaspoon of true cinnamon powder in lukewarm water, herbal tea, or sprinkled into dal or vegetables works best. Heating it gently during cooking allows its polyphenols to release gradually, making it easier for the body to absorb. Avoid excessive intake. Certain varieties of cinnamon contain a compound called coumarin, which may stress the liver if consumed in high amounts over time. Number 1, curry leaves here is something most people use almost daily but rarely think of as blood sugar support. Curry leaves contain natural plant compounds that quietly help your body handle glucose better, especially when blood sugar tends to rise after meals. One of the most important components is mahanimbine, along with other carbazole alkaloids. These compounds work by improving how your cells use glucose. In many people with diabetes, the cells become resistant and stop responding properly. Curry leaf compounds help improve this response so that glucose moves into cells more smoothly instead of staying in the bloodstream. Curry leaves also contain powerful antioxidants, quercetin, beta-carotene, and natural flavonoids. Think of these antioxidants as a protective shield for your pancreas. High blood sugar creates stress inside the pancreatic cells that produce insulin, and over time, these cells become weaker. The antioxidants in curry leaves reduce the stress and help protect those insulin-producing cells so they continue working more steadily. Another helpful action happens during digestion. Curry leaves have mild fiber and plant chemicals that slow down how quickly carbohydrates break into glucose. This does not block digestion, but it prevents the sudden rush of sugar into the blood that causes spikes and crashes. Because the rise becomes smoother, many people feel more stable energy levels and fewer cravings between meals. There is also a gentle effect on fat metabolism. Certain compounds in curry leaves help reduce excess triglyceride buildup in the liver. This matters because fatty liver and insulin resistance often go hand in hand. By supporting liver health, curry leaves indirectly make blood sugar control easier. The right way to consume them: chew 5 to 7 fresh curry leaves in the morning or add them generously to your dal, vegetables, or cooking during the day. Light cooking actually helps release their beneficial compounds while keeping them easy to digest. Consistency is more important than quantity. Of these 4 ingredients, fenugreek seeds, jasmine seed powder, cinnamon, azimut, and curry leaves, which one are you going to start with? Drop your answer in the comments right now. We read every single comment and we want to hear from you. Bringing it all together. These 4 ingredients are not magic pills, but they work when used consistently. Start small. Soak fenugreek seeds overnight and have them every morning. Add jasmine seed powder after lunch. Sprinkle cinnamon into your tea or dal. Chew curry leaves daily. None of these steps are complicated, none of them are expensive, and none of them require a trip to a specialty store, not because they are already in your kitchen. Diabetes does not develop overnight, and it will not worsen overnight either, but every small step today protects your pancreas and your blood vessels tomorrow. The cumulative effect of these simple daily habits, done consistently over weeks and months, is far more powerful than any single intervention done occasionally. Here is what we need you to do right now. 3 things. 1. Drop a comment below and let us know which of these 4 ingredients surprised you the most, or tell us if there is another ingredient you would like us to cover in a future video. Every single comment get read and may feature your question in our next video. 2. Share this video right now with someone in your life who is managing blood sugar or trying to prevent diabetes. A family member, a friend, a neighbor. Information like this only reaches the people who need it when someone cares enough to share it. That someone can be you. 3. Subscribe to Health is Golden and turn on your notifications if you have not already. We release new videos every week covering the practical, evidence-based health strategies that matter most, explained clearly and without the jargon. Because as we always say, it is never just a diet, it is always a lifestyle. This is Health is Golden. Stay healthy, stay informed, and take care of yourself.